Okay, so based off my history and assessment of your injuries, as well as the testing that I've done, I have concluded that you have a second-degree sprain to the lateral ligaments of your ankle. So, on your ankle, it's made up of a lot of different bones that are moved together to create the movements that your foot does. For each of these joints between two bones, there's ligaments that hold them in place to help stabilize your ankle as a whole and stabilize the joint, preventing it from moving too much. What you did is when you were playing soccer and you ran, when you fell on the person's foot, your ankle went in like this, putting a lot of stress in this region of your foot. If you look at a picture of your ligaments, you can see that on that area, there's three main ligaments that are present. You have your calcaneofibril ligament, which connects the calcaneus, or the heel of your foot that most people know it as, to your fibula, which is the bone that runs from here to here. The bump that's on your ankle there, that is where they connect to the calcaneus. The other one you have is your talofibril, and there's two. There's the anterior and posterior. Your anterior connects from the front of your talus, which is the dome that allows your foot to do that pointing and flexing action, to the fibril malleolus of the fibril, which is the bump on your ankle, and then there's one in the back that does the back of the talus to the fibril malleolus of the fibula. What happened is when you went into that motion, you went into this action, which put a lot of stress and stretched the ligaments here. When you stressed those ligaments, it created pull and created some tears in the fibers. When you have a second degree, you have a lot of swelling, a lot of bruising, and a lot of pain because at least half of those fibers are torn. Usually what happens when you do your actions, when you plantar flex and invert, you're putting even more stretch on that area, creating more pull of already damaged ligaments, which is why you have the increase of pain. Because of your swelling, when you try to do dorsiflexion, there's just not enough space in your ankle for you to be able to do the full movement without there being some restriction from the fluid that is now in your ankle. So when you try to do this, it's not necessarily because you're hurting the ligaments that are damaged, it's because you just don't have the space to do a lot of the movement, which is causing the pressure. These injuries are commonly occur from acute trauma, so things like running and your ankle going in, you stepping on a divot and the ground changing from what your body was expecting creates you to go into a motion that's past the limit of where the ligaments can stretch without being damaged. And this is what happened in your case. When you landed on the athlete's foot, your foot went into that vertical position and thus stretched the ligaments. Typically with these kind of injuries, you see three kind of phases. The first is the swelling phase or the inflammation phase. And this is an important phase because inflammation allows nutrients, blood, and macrophages, which help reduce and repair the ligaments, gets the area. While it's good, we want to limit it to a certain amount because we don't want there to be so much swelling that that ligament or those areas don't get blood, don't get oxygen. The structures around the ligaments still need the blood, still need oxygen as well. If there's too much swelling, it can prevent the flow of nutrients to those areas, so we do want to limit it somewhat. Because of this, our first step will kind of be to treat that swelling by resting, putting compression, and doing some ice. We can elevate it to help flow the movement, the blood back to the heart, and the liquid back to the heart, and the compression will also help with that venous return of blood to the heart and pushing out excess fluid. During this, we want to make sure we keep some passage range of motion so we don't lose it, and also the movement will help pump excess fluid back to the heart through the movement as well. The next is we want to reinforce and regain our active range of motion without pain once the swelling goes down. For this, we can start doing some gravity-assisted active range of motion, so gravity is helping you do the movement. We can do then gravity neutral, where gravity isn't playing a role in it, and then we can eventually progress to gravity against gravity, where you are moving against gravity and producing the movement on your own. After that, we can then work on your peroneus muscles, which did come back weak. The trouble with having weak muscles, especially your peroneus longus, is that it helps it starts here and it attaches at the bottom of the foot, and it helps in the motion of plantar flexion and eversion, which protects you from going into that stretch position where your ligaments are at risk. Sorry, not plantar flexion, dorsiflexion and eversion, where it stops you from going into that plantar and inversion that puts your ligaments at risk. If we strengthen that, it helps stabilize the ankle more and can prevent future vulnerability to re-injuring, because your foot will be able to adapt better and thus pull you back into the less vulnerable position than if it's weaker. Yeah. So as for that, if you have any questions or concerns, you can feel free to ask, and hopefully we can help heal your ankle soon.